Hello and welcome to the One Program Continuing Education Review modules. Module 3, titled One Program Screening Tool Updates, will be covered today. My name is Oliver Frenzel and I am a pharmacist with the One Program. This module has 3 learning objectives. 1, we'll discuss and review the One Program Screening Tool. 2nd, we'll discuss updates and changes to the One Program Screening Tool. And 3rd, we'll review and interpret a completed patient screening form. One program screening tool is a comprehensive approach to stratifying the risk of adverse events and potential opioid harms for individuals filling an opioid medication at the pharmacy. The screening tool is composed of 2 sections. The upper portion is the ORT, also known as the opioid risk tool. This section gathers the patient's personal history, family history, and comorbid psychological conditions that have a high level of association with future development of opioid use disorder. The ORT is not a diagnostic tool, but rather a screening tool with a high level of sensitivity and specificity in predicting development of OUD in patients using opioid medications. The screening tool is intended to be used in patient populations prior to starting an opioid therapy for pain management and for patients continuing opioid therapy for pain management. The lower portion of the One Program Screening Tool focuses on risks for accidental opioid overdose, which includes comorbidities and also the potential for concurrent medications or substances to be used during the opioid therapy that will increase the risk of opioid-induced respiratory depression and mortality. ORT was developed in 2005 and is intended to be completed by the patient themselves while at the pharmacy. This tool is the most widely adopted opioid use disorder screening tool in the United States by healthcare professionals. It is endorsed by SAMHSA, a Substance Abuse and Mental Health Services Administration, and the tool has been validated in both male and female patients using opioid medications for pain management. Each item that is selected yes by the patient on the ORT is weighted and requires a scoring tool to generate a risk score for the patient. This is seen on the right-hand side of the ORT. Individuals that indicate a score of equal to or greater than 8 are at high risk for future development of opioid use disorder. The second portion of the One Screening Tool, or the lower portion of the screening tool, is for accidental opioid overdose assessment. We have conducted numerous literature reviews to establish what conditions and or concurrent medications can lead to accidental opioid overdose. All items on the overdose risk assessment section have indicated a high level of evidence and strong level of association for opioid-induced respiratory depression, and thereby predisposes or categorizes individuals as high risk for overdose events. Medical conditions that are associated with opioid overdose include COPD emphysema, sleep apnea, liver disease, and kidney disease. These align with compromised pulmonary function and also reduced capacity for opioid elimination and opioid metabolism. Concurrent substances or medications that have been linked to a high association for overdose when used with opioids include benzodiazepines, neuropathic pain modalities, for example, gabapentin, pregabalin, muscle relaxers, sedative hypnotics, alcohol use, and additional opioid combinations. These align with extensive evidence linking central nervous system depressants and elevated levels of morphine milligram equivalents associated with high risk of opioid-induced respiratory depression. For the past 5 years, the One Program has continued to review best practices and current evidence-based recommendations for opioid risk screening and harm reduction interventions. To ensure that pharmacies are using the most accurate and effective risk screening resource for their patients, we have determined that a few changes are warranted to the One screening form. Age, asthma, depression, and anxiety have been removed from the accidental opioid overdose assessment due to the low strength of association between opioid overdose when concurrently used with an opioid medication. In addition, cough and cold preparations and the use of antidepressants have also been removed for the same concern of newer evidence pointing to a lower level of association between opioid use and opioid-induced respiratory depression. Lastly, more evidence has shown that certain neuropathic pain management modalities, more specifically gabapentin and pregabalin, have increased risk of opioid overdose when concurrently used with opioid medications. A research article from 2019 revealed that individuals that use opioid medications with gabapentin or pregabalin have 2 times higher likelihood of experiencing an opioid overdose event as compared to the use of opioids alone. With the vast amount of opioid-focused research evolving over the last 5 years, we determined that these changes more accurately and effectively identify patients at risk for an opioid overdose to focus harm prevention efforts toward the patients we serve. Next, I would like to share with you a completed patient screening form and walk through the scoring process and interpretation. First, we'll walk through the upper portion that assesses the risk of developing opioid use disorder. In this example, the patient has indicated a personal history and family history of alcohol abuse. The age of the patient is 24 years old, which falls into the 16 to 45 age group item. And both items related to psychological condition comorbidities. We use the male scoring column, and these items total a score of 10. So a score of 10 is greater than 8, and we know any score either 8 or greater is categorized as a high risk for development of opioid use disorder. The lower portion of the screening tool for the overdose assessment indicates that the patient does not have any comorbidities, including COPD, sleep apnea, liver disease, etc. However, the patient did indicate that he will be using a benzodiazepine and also either gabapentin or pregabalin. Any one or more items that are selected yes would then lead to the patient being categorized as high risk for accidental opioid overdose. For example, if one patient only selected one item, or if another patient selected 3 items, both patients would be categorized as high risk for an overdose event. So this section is different from the above ORT portion, in which the overdose risk assessment is not weighted and does not need a scoring tool.